Hi, my name is Dr. Desai, board certified cosmetic and plastic surgeon. I've passed out and done my super specialty from Sir J.J. Group of Hospitals. Hair transplant is a field which is very close to me. I've been practicing for over 21 years. We've had multiple centers across the country and we send our teams all over. I have actually trained more than 150 doctors till date in India and abroad, and I'm a part of various hair loss and hair transplant societies globally and in India, and I founded the Hair Society of India. I am the chairman and the founder member of this society. I'm also on the board of FUE Asia, FUE Europe. I'm on the scientific board of IMCAS, and I actually curate the entire hair program for them. So yes, hair is very close to me. I keep myself updated by continuous medical education. I've written chapters and I have many publications across various journals. Now, hair transplant is a very tricky thing. It can have a lot of complications. You don't want to face the complications and treat them. You want to actually prevent them. First, to understand what are these complications, you have to understand that this is the donor area, the back of the head, which is where the hair are permanent, and this is where you can lose hair, the recipient area. So everybody now knows about the donor and the recipient area. So what is hair transplant? We take hair from the permanent areas, which is the back and the sides, and take extra hair from here and transplant it into the blank area, the recipient area, where there are no roots. Sometimes we can also use beard hair, body hair, if that is of good quality, and we can transplant into the recipient areas. Either we can do this by the FUT method or FUE method, or third, of course, is the advanced form of FUE with certain processes, protocols, and instruments known as DHI. Now, what is FUT and what complications can occur? You cut a strip of skin along with hair and you cut out one hair follicle and implant it here. The only advantage of FUT is it's a little faster than FUE. But number one, you have to stitch that part so it leaves a scar. Okay, sometimes the scar may stretch, it may look untidy. Number two, it can damage nerves, it can damage vessels, can cause bleeding. Third, because there's cutting, stitching involved, if it's not done properly, it may cause infections. Fourth, if you take a large strip and close it, it may not close fully, and hence it will leave a big wound which will take time to heal and will leave terrible scars. And if you close it too tight, if you take it a large strip for more grafts, close it too tight, surrounding hair go into pressure and there may be effluvium or loss of hair from these areas or shock loss. So these are the problems that are typically encountered with strip, which is practically not done in today's world. Everybody does FUE and of course the specialized technique DHI that is exclusive to us and our clinics, which I'm going to be talking about. Now, what is FUE? Where we take punches, okay? We take sharp or blunt punches, either with mechanical or motor. We remove one hair follicle individually from the donor area, okay, directly. Now, if you take a large punch, you'll have large scars, more bleeding, damage to surrounding hair, effluvium of the donor, that is loss of the donor hair, okay? Patient cannot shave because of the scars that are left behind. So these are the problems if you don't do it properly. Now, if you over harvest or take too much hair from the donor, then also you can get an emptiness and big scars there. If you take very close by, like if these are the 4 hair follicles, you should take only 1 out of these. If you take 3 out of these, you leave back terrible scars and you leave back empty patches, which are very common, and that should be avoided completely. That is a very classical mistake which is done in novice clinics or people who don't understand hair transplant. With DHI, the mechanical method that we follow, we take thin punches, we carefully remove 1 out of every 3rd or 4th hair carefully so it doesn't damage the surrounding hair, and the size of the hole is very small because there's no motor damage, there's no heat created, and hence the graft comes out intact without any problem and very fast healing and very tiny scars. Patient even shaves in the future, you cannot see the scars or the white dots which are there. Okay, so this is how you prevent complications of FUT and FUE, mainly in the donor area. Now when I'm talking about the recipient area, what can go wrong, right? If you do not put the grafts in the proper way, it will give aesthetic problems and otherwise other medical problems. Now before we go into that, you have to give anesthesia during hair transplant. If you do not know the right doses of anesthesia, you can give a large dose and you can get toxicity of the anesthesia, which can affect the heart and the liver and the kidneys. And there have been occasional, and I don't want to scare you all, but deaths reported. Such things have only happened when it is done by technicians in unqualified clinics, because the qualified doctor will always know what dose of anesthesia is right for the patient and he will never exceed it. So getting a death in hair transplant is unacceptable and unheard of. That is why don't go for cheap places. Always find out the credential of doctor. Only go to qualified doctors, because he knows what plane to give the anesthesia, where to give the anesthesia, and how much dose to give and not to exceed. So that's important. Second, if you give lot of adrenaline, which is used to basically reduce the bleeding in the anesthesia fluid, then also you can get heart complications. So go to the qualified doctors, because a qualified doctor always knows how much of adrenaline to put and how much is overdose. Okay, that is also very important. Third, rarely you can get allergy to this anesthesia. So in our clinic, before giving the anesthesia, we give a small test dose in the forearm, check if there's any allergy. If there's allergy, then we don't go do the hair transplant. Fourth, if you have not studied your patient properly and he has medical complications, heart diseases, blood pressure, you've not taken care of them, okay, then he can get complication of this anesthesia or long surgery. So in our clinic, we have a complete ICU setup in the hospital. We have central oxygen. We have all the machines available like defibrillators, etc. Hair transplant is a surgical procedure. You should not be taken lightly. Complications are very, very, very rare in good hands. But once in a while, if something occurs, you should have the full backup facilities in order to prevent all these complications. High Court of Delhi has specifically passed an order that hair transplant should only be done by qualified people, number one. And number two, it should be done in a hospital setup. In our clinics, we have a hospital setup. So right now where we are standing is one of the hair transplant rooms and procedure rooms. And the hospital setup is right below here, where we have an ICU and qualified cardiologists and physicians who are available 24 hours for us. So that is very important. Safety is a priority and keep that in mind. Now coming to the other complications, if you don't put the hair in the right place, then it will give you unnatural results. It will give you a funny looking hairline. If you don't draw the hairline properly, it won't be proper. If you put the hair root in different direction, then you get hair which are growing in different roots and direction. Sometimes the hair are standing up, which looks very ugly. So it has to be put in a proper way, proper depth, proper direction and proper angle. So these create aesthetic results, aesthetic problems. If you put the hair root too superficial or too deep, you get like a cobblestoning. So the patient combs his hair, you get like dotted appearance, like a cobblestone street, okay, which also looks very ugly or unsightly. The commonest mistake what I've seen a lot of surgeons make is put the hair root straight. The hair comes out of the scalp at an angle, and then you comb it in either direction. But sometimes they just try to put it straight in, so the hair kind of stands up, and that looks very funny. It actually changes the whole look of the patient, and the hair becomes unmanageable. Typically they come back saying that I can't comb my hair properly because my hair is standing up in different directions. So this becomes a big problem for every patient. So putting the hair in a proper way, in an aesthetic way, proper angle, proper direction, proper design, and is very, very crucial when you're talking about hair transplant. This is the aesthetic complications. Now, if you try to put hair too close to each other, then it will compromise the blood supply and there'll be a patch of dead skin there. That is, I've seen that happening in 2 or 3 patients, not our patients, but outside. So don't try to overdo anything, okay? If you put it too far, it will look very ugly. It will look as if some random grass growing here and there. That also will not look good. Now, hair is irregularly irregular. God has not planted hair in one straight line. And another commonest mistake, doctors tend to plant them in rows and columns, which actually looks as if you're gardening or actually you're growing grass rather than doing a hair transplant, because the hair should be irregular and randomly placed, and that is the beauty of a very good and a natural hair transplant. So these are the various complications, right from bleeding, ugly scars, donor area effluvium or loss. Now recipient area effluvium. If there are existing hair and you try to put too many hair in between, what will happen? These new hair will take away the blood supply from the existing hair, and the existing hair will become weak and they will fall, which is known as shock loss or recipient area effluvium. How to prevent this? You give pre-medication, make these other weak hairs strong first. improve the blood supply to the scalp, nutrition to the scalp, and then do a transplant and then continue these medications post-operatively. You may do exosomes or PRP or GFC so that these hair and the other hair get enough nutrition, and hence this shock loss does not occur. So things like these are very, very crucial, and this can only be done by an experienced and a qualified surgeon who knows what he's doing and who's well read and who's well versed with what goes on in the world. This is how you prevent complications, and this is how you will not get complications. 21 years we've been practicing, practically do 2 to 3 hair transplants every single day at our clinic, and we've rarely had any kind of complication. Only sometimes patients come telling us, okay, doc, I'm not happy with the density, but that is a perception. We feel it may be enough. Patient may feel that he may need more, but that is not a complication. That can be fixed. If that is the case, you can go and put some more hair. It does not matter. So yes, this is very important. And poor results. Poor results are because of improper storage of the grafts. If you don't store them at the right temperature, if you don't hydrate them while storing, and then in that case, what happens is they will become dry and they will not survive. If you crush them while putting, they will not survive. Okay, if the temperature is too high for the grafts, they will get heat damage, they will not survive. If you pack them too close, then what will happen? Only a few of them will survive. Survival of the fittest, others won't survive. Okay, and you get poor growth. If you do not choose your patient properly, if the donor area itself is not adequate or proper, in that case, if you put grafts only which are unhealthy or not of good quality, they will not survive enough. So it's important to get proper analysis done, go to the right place and get great results every time you do a hair transplant. Remember one thing, once a follicle is removed from the back and put here, and if it does not grow hair, it is lost for life, because what is removed from here will not come back. So respect each and every follicle before you do a hair transplant. Make sure that every follicle survives and aim for 100% graft survival. The average industry graft survival is 70 to 80%, but we aim at our clinic for more than 95% of graft survival in every case. So respect each and every hair follicle to get great and natural results every time. Thank you.